The heart and its coronary arteries are in constant motion and therefore are very difficult to image. This animation demonstrates the complex motion of the coronaries and analyzes the exact timing required to capture a precise image of each individual coronary artery. The performance of a state-of-the-art prospectively triggered multi-slice computed tomography, or CT technology, optimized using partial scanning reconstruction techniques, is compared to Imatron's state-of-the-art prospectively triggered electron beam tomography, or EBT technology. Each bead of this anatomically correct three-dimensional heart accurately depicts the motion of all of the coronary arteries along their entire length and in all dimensions. It has been carefully reviewed and approved by renowned experts in the fields of heart ballistics and cardiac imaging. Although the heart has periods of no electrical activity, it is always rapidly moving. The electrocardiogram, or ECG, maps the electrical activity of the heart. This activity is characterized by waves that are named by the letters P, Q, R, S, T, U. The R to R interval graphically represents the time interval of one heartbeat. For a heart rate of 60 beats per minute, one R to R interval is 1 second, or 1,000 milliseconds, which can be divided into 10 sections of 100 milliseconds each. Each section along the x-axis represents 10% of the R to R interval, ranging from 0 to 100%. The y-axis describes coronary velocity in millimeters per second. Using these measurements, a graph describing the average motion of all of the coronary arteries can be plotted. Breaking this down into individual arteries, we find that the LAD is the slowest moving and therefore easiest to image. The circumflex moves faster, and the RCA is the fastest. The graph now illustrates the velocity of all of the coronary arteries throughout the period of one complete heartbeat. The coronary artery with the greatest amount of motion and therefore the hardest to image is the RCA. During each cardiac cycle, the ideal time to image the RCA corresponds to the area of lowest velocity and therefore least movement, called displacement. This point in time corresponds to N systole, or the U wave, on the ECG. Extracting a cross-sectional image of this beating heart in the midsection of the RCA shows a view of the RCA in the area where it experiences maximum displacement. This view allows a closer examination of RCA motion. In the exact location and orientation, images are acquired by both CT and EBT technologies. Notice the rapid and continuous movement of the RCA throughout the cardiac cycle, a distance greater than 5 times the vessel's own diameter. Prospective triggering allows the acquisition to begin at a specific time in the R to R interval. This advanced capability is widely used and established on all EBT scanners and has recently been incorporated into several models of CT scanners. For the initial comparison, both CT and EBT acquisitions are prospectively triggered at the start of the U wave. A CT acquisition is demonstrated. The scan, represented with a red line, is prospectively triggered and continues for 320 milliseconds across the x-axis. The amount of time during the R to R interval that is used for acquisition of data is called the temporal or time resolution. The simulated scan shows the severe motion of the RCA during the CT acquisition. Clearly, there is no so-called rest phase of the heart, even during periods of low or no electrical activity. The diagram shows the displacement or distance traveled over the image acquisition period. Note that the area beneath the RCA velocity curve, highlighted in green, represents the duration of the acquisition multiplied by the velocity that the artery was moving at each point during the acquisition. This area is therefore symbolic of the total amount of motion or blurring present in the image. An EBT acquisition is demonstrated. The scan, represented here with a red line, is also prospectively triggered and continues for 100 milliseconds across the x-axis. The resulting scan shows slight motion of the coronary artery during the EBT acquisition. The area under the curve is small and is shown as a fine blue line, which depicts minimal coronary motion. When viewing both the EBT and CT diagrams side by side, based upon a heart rate of 60 beats per minute, one notices that the CT device only acquires data every other heartbeat. This is because today's most advanced CT scanners use most of the R2R interval acquiring data and therefore do not have time to increment the table before the ideal trigger point in the next heartbeat. Imaging every other heartbeat often requires 2 breath holds to complete each CT examination. As the heart rate increases, notice that the time of the R2R interval decreases, even as each technology's acquisition time remains constant. The longer CT acquisition quickly begins to acquire data from the later parts of the R2R interval. The amount of motion of the RCA is subsequently increased and is represented by the lighter green area. The red flashing signifies that manufacturers of sub-second CT scanners do not recommend imaging of patients with heart rates above 70 beats per minute. Given that patients' heart rates are most often higher, this is a serious limitation. As the heart rate increases further, the CT technology begins acquiring data during the R wave itself, a period of maximum coronary velocity. The acquisition will then begin to span 2 heartbeats instead of 1. Further improvements in image quality can then be investigated by varying the trigger point. It is important to note that only EBT can prospectively trigger at later points in the R2R interval without acquiring data during periods of high coronary velocity. For some patients whose heart rate is slower than 68 beats per minute, the velocity curve changes, and an RCA imaged on EBT further sharpens when the trigger point is shifted to optimize the acquisition based upon the patient's individual heart rate. Often, the optimal point is near 70%. The RCA imaged on CT blurs more if adjusted to the right due to the longer acquisition time and is found to be optimized at 40% regardless of the patient's heart rate. While the image acquisition time of the EBT technology is more than 3 times faster than the fastest CT, an analysis of triggering and complex coronary motion yields a profound scientific result. EBT technology often images the mid-RCA with over 20 times less displacement.